everyone. I'm Liise-Anne Pirofski. I'm the chief of the Division of Infectious Diseases at Albert Einstein College of Medicine and Montefiore Medical Center. And I have the great honor of interviewing my colleague, friend, and faculty member, Theresa Madaline.
Thank you, Dr. Pirofski. I am the healthcare epidemiologist for Montefiore Health System, which means that I oversee things like infection control, hospital epidemiology, and our outbreak and pandemic response.
I'm wondering, from your vantage point of your incredibly weighty position, what you feel contributed to the enormous community spirit and camaraderie that we had at Montefiore. How did we manage the fear? Obviously it didn't go away, but how was it controlled? What do you think the elements were that made us be able to keep our heads up and keep going?
That's a great question. And I really, too, was touched and really inspired by the level of teamwork, willingness to help other people, camaraderie, and really how people manage to keep their spirits up at an incredibly difficult and stressful time. It's truly remarkable. I think some of that is just, as you say, in the medical community, the desire to heal. And that faced with this public health crisis, everyone really committed to saying, we are all here to try to help these people. This is, really dangerous. A lot of people are hurting. A lot of people are suffering. And our job here is to do everything we possibly can together to relieve that suffering and care for people, no matter how many people come, no matter how many hours it's been since I've slept. My role here is to heal, and that's what I'm going to do. And I think that overarching belief and commitment from everyone really drove us all forward. I think the other parts of this, perhaps a little bit more subtle, but very important, are communication. I believe that when we communicate clearly with one another, when we all are talking about a shared vision and a shared goal, it really brings people together, and it's able to overcome that fear and anxiety and give people a sense of purpose and mission at a time that's extremely stressful. For me, I think, I tried to send that message from where I'm sitting, but I know many others did as well. There was tremendous leadership from around the organization, and every leader of every department I know was sending that very, very same message to their team. They were meeting all the time and, telling everybody, we're in this together. We have got this. I'm here for you, you're here for me, and we're going to get through this together. I think the other thing that really helps is there was a tremendous acknowledgement and focus early on that wellness and providing support to people was going to be extremely important. Our psychiatry department actually did tremendous things, and they did it so quietly and so elegantly, but it was really meaningful. They actually, at one point, they had set up a caregiver support system, which already existed, but they tried to really add resources to it. But they eventually decided that they weren't even satisfied with that. And so instead, their chair, Dr. Alpert, decided that they were going to proactively reach out to every frontline provider and call them and just say, how are you doing? It's okay if you can't talk now, but here's my number. I'm your person. And when you're ready, I want you to call me. We'll set up time, and I'm here for you. I've got you. I've got your back. That, I think, is a perfect example of the kind of support that's actually really effective. It's pushing out to people what they really need at a time of crisis. So that, I think, was extremely beneficial. We also had support from our child life specialists. So we have a children's hospital at Montefiore, and they spent a lot of time simply sending positive messages to people. Every day when I walked into the hospital, there were these beautiful chalk drawings of encouragement, just these words of encouragement. And they meant so much to me. It's such a simple, small thing, but to see that as the first thing when you're walking into a hospital full of incredibly sick people actually means a lot. So I think all of those subtle, small ways that people chipped in to say, we've got this, we're here together, really, really mattered. Little things like, free food and free parking and all the little supports that were put into place for the staff, I think all together with good leadership and good communication about the fact that we acknowledge this is hard, but we're going to do it anyway, and we're going to come out the other side stronger. Altogether, really was able to keep everybody's eye on the prize.